According to healthcaredigital.com, over 65% of healthcare workers have at least one child in daycare. Having on-site child care for healthcare workers would provide great benefits for the employer and employee. I have experienced this as a child working with both parents who are in healthcare struggle with child care arrangements. With my dad working in surgery, his schedule is always unpredictable. He is required to have calls on weekends with a short response time. My mother was on call for neurology on weekends, and without having child care nearby, we had to go with her. We would sit in ICU or the ER at a desk for a couple hours at a time until the work was finished. Having on-site child care been available, it would make this easier on both parents and children. On-site child care benefits the employer and employee. There are many benefits of employees having on-site child care. Employees need child care hours that match their work hours. If the hospitals that my parents worked at had on-site child care, it would decrease their response time and decrease worry in an already stressful situation. www.nursemoneytalk.com states that employers take the money directly from your check for daycare fees. This would be beneficial for single-family incomes to allow for pre-tax payments. Having on-site child care benefits employees greatly. Now I will tell you how hospital-based child care will benefit the employers. Employers also benefit greatly when they provide on-site child care. Child care struggles are present in all working families, but are more difficult in the healthcare industry due to long hours and on-call times. A recent study from Care.com estimated that at least 4 million U.S. workers resigned each month during the second half of 2021, nearly half of them citing that they were struggling with child care. This information was found on scrubsmag.com. Having on-site child care makes hospitals more marketable to doctors and nurses. It increases staff loyalty and longevity. Now that we know the benefits of on-site child care, we can all agree that this needs to happen. Hospitals should provide employees with child care. As I've already mentioned, employees will be able to provide more efficient care to patients and families when the stress of child care is minimized. They know there will be an easily accessible place for their children to be while they focus on their job. By having this implemented, employers benefit by making them look marketable to workers. This would help them to recruit the best healthcare providers for the community and stand out to others. In conclusion, on-site child care is very beneficial and should be offered by every workplace. Employer-based child care benefits both the employee and employer by providing flexibility to workers, ease staffing shortages, and increase employee retention. When this is implemented, it will decrease over half of a hospital's employee stress of balancing work and child care.